रागादिरोगान् सततानुशक्तान् शेषकाय प्रसृतान् अशेषान् औत्सुक्यमोहारतिदान् जघान यो पूर्ववैद्याय नमोस्तु तस्मै. Welcome to this webinar reporting Ayurveda clinical practice outcome of COVID-19. On this auspicious day of Buddha Purnima, we have organized this webinar with the intention of exposure to the practice of writing case report and case series. As we all know, thousands of Ayurveda physicians, they are contributing in the management of COVID-19. They are treating very difficult cases, and this is time to share our learning. With this intention, we have planned this webinar, and this is a collaborative activity of many reputed institutions. National Institute of Ayurveda, All India Institute of Ayurveda, Institute of Teaching and Research of Ayurveda, AYUSH Center of Excellence, Savitribai Phule, Pune University, Amruta School of Ayurveda, and Banaras Hindu University, Bharati Vidyapith, deemed universities, Ayurveda School, and Irsha, Ayurveda Pharmacy, and many reputed journals, Annals of Ayurveda, Ancient Science of Life, Journal of Ayurveda and Indian Journal of Ayurveda and Integrative Medicine, Journal of Ayurveda Case Reports, and many journals. They have joined together to organize this workshop. I request Vaidya Ramanoharji, who is director of Amruta School of Ayurveda, to give.
Namaste. Thank you, Dr. Girish. And it's a great pleasure and honor to be here. I think we are initiating a very important activity in the context of COVID-19, especially the second wave, which took our country by surprise, really overwhelmed our healthcare system. And not even in the first wave of COVID-19, the Ayurvedic community had responded, but at that time, there were more challenges in bringing out Ayurvedic treatment to the general public. But due to the commendable efforts by the Ministry of AYUSH, a lot of these hurdles have been overcome, and many studies have been done. Pharmacological interventions like AYUSH 64 and Kabasura Kudineer have been made official now. There are national protocols being integrated to the standard of care. So a lot of things have happened. But I think one of the areas where we are still lacking is at the ground level. There have been a lot of Ayurvedic clinicians who have been doing tremendous service. I have also been following a lot of such patients being treated by Ayurvedic clinicians. And now in the process, I have also become a case report. And I feel all the more the necessity that these experiences should be shared, and shared in a rigorous manner. Because we need, when we are reporting about outcomes related to COVID-19, we need to make sure that we distinguish between tall claims and facts. And one of the ways to do that is to that whatever experiences the clinicians are gaining in the treatment of COVID-19, because I think there are limitations to research. It's very, very difficult to do well-planned research, the sample size, the hurdles that are still there, the regulatory hurdles to do, research on a large scale and with, participation from large number of institutions or even clinicians. I know a lot of clinicians would want to do many studies, but it's not easy for them to plan a study. So there is a lot of limitation in doing such kind of work. But one of the areas where clinicians are able to do things more freely is at the level of clinical practice. And these experiences, unfortunately, they are mostly being shared on social media, and that actually brings down their value. And when people start claiming, saying this medicine was given, oxygen came down in 5 minutes, in half an hour, when these kind of claims abound in social media, the very credibility of Ayurvedic interventions will be questioned. So we need a formal platform where clinicians can very rigorously report their clinical practice outcomes. And for that, good case reports, I think, is the most important step. So it is with that intention, as Dr. Girish had just right now, that this whole series of hands-on writing case reports for those clinicians who have the experience in treating COVID patients and who have data and who are finding it difficult to present it in a systematic way. I mean, this whole initiative is to facilitate that, so that we have as many reports based on clinical experiences from across the country, archived in good journals. Later, our experts here will explain how we can go through this process from previous to regular indexed high quality journals. So that's the whole idea. I'm not taking much time because we have a whole galaxy of experts here to share their views and expertise. But at the outset, I would like to welcome all the distinguished dignitaries and experts who have come here. First of all, the Honorable Secretary of the Ministry of AYUSH, Vaidya Rajesh Kotecha ji. I hope he has already joined or will be joining in. I would like to really thank him wholeheartedly for this moral support, and under his leadership, the Ministry of AYUSH has taken exemplary steps. So welcome, sir, and for being with us today during this event, and we look forward to your guidance and encouragement. I would also like to wholeheartedly welcome Dr. Tanuja Nesari, the Director of All India Institute of Ayurveda. The All India Institute of Ayurveda has also been taking really great leadership and very, very important steps in the AYUSH response to the COVID-19 pandemic. Very important studies have happened there. Protocols have been developed. And yet, welcome, Kotecha ji. I just saw the message that you have joined. Thank you so much. Dr. Geeta Krishnan, technical advisor of the World Health Organization. I mean, he has also been very silently, has been doing a lot of silent work. A lot of people do not know the quantum of his contributions to this initiative. Dr. Anup Thakurji from ITRA is also here with us, and thank you so much for joining. Dr. Sanjeev Sharma, Director of National Institute, have also been contributions to there. And then I'm not spending much time. I'll make my introduction very brief. There are a whole lot of experts here. So Dr. Sanjeev Rastogi, well known as the editor of AAM, which is becoming a very good learning platform for Ayurveda professionals to write professional research papers. Dr. Kishore Patwardhan from BHU, Dr. P. M. Unikrishnan from TDU, Dr. Supriya Bhalerao from Bharati Vidyapeeth, Dr. Ashmita Vele also from Bharati Vidyapeeth, Dr. Somit Kumar from ABP Research Foundation, Dr. Pawan Kumar from National Institute of Ayurveda, and then Dr. Galib from All India Institute of Ayurveda, and last but not the least, Dr. Girish Tillu. You can imagine how challenging it is for me to, welcome each one of them personally. So please pardon me, we don't have time. I welcome all of you, and of course, all the participants of this webinar. I wholeheartedly welcome you. I hope this will be a very major step in showing the experiences of clinicians in managing COVID-19. And with these words and prayers to Dhanvantari for the success of this initiative, I conclude my words. Thank you. Namaste.
Dhanyavad Ram Manoharji. We request Vaidya Rajesh Kotecharji, who is the leader of our transformation of Ayush fraternity, and Vaidya Kotecharji stood firm behind all these initiatives, and he is really a force of inspiration to all of us. I request Vaidya Kotecharji for his remarks.
Thank you, Dr. Gage Tiluji. Dear Dr. Ram Manoharji, all the distinguished panelists, the leaders of national institutes, all the teachers, scholars. This is a privilege for me to be here because it's a platform where all these experts are going to do some Tadvidya Sambhasha, and we'll try to find out some Navnit from this Sambhasha, and with a specific objective that is very important. I could see that in a very short period of time, because this is arranged only few days back, and today we have 500 plus participants into this webinar. So it shows how this topic is important, how it is relevant, particularly into these pandemic times. From ministry perspective, from the beginning, you all know that we have got, and we were actually flooded with lot of claims, lot of requests, lot of proposals that we have invented, or we have practiced this, or we have tried this on the patients of COVID, and this is working. So it should be mainstreamed, it should be recommended. So then these requests were enormous. You won't believe, but we have created a crowdsourced platform not to collect money, but to collect these ideas on the website of AYUSH. And we have received more than 4,000 such claims. And this shows that how much enthusiasm was there and how much people wanted from their heart to help the community. So it's a very positive perspective that everybody was rushing to help the people. And that was very inspiring for me also. And we have created ecosystem, we have created, a kind of scrutiny from the scientists, and then Ayush task force, very was very important. Asmita ji, can you अस्मिता जी, आप एक बार अनम्यूट अपना म्यूट करिए अस्मिता जी, प्लीज.
Yes.
Administrator, can you mute Asmita ji? Can you help Asmita ji to mute her mic? So this was an experience, and then based on this experience, a lot of things has happened in last more than 1 year. And we all know that all these things are in public domain, that with the help of task force, there was initiation of huge studies with the help of different institutions. I'm happy that today all these institutions who have helped into this endeavor of Govt of India for different evidence generation and studies, all of them are onboarded today, like Savitribai Phule University, Amrita School of Ayurveda, our own institutes, ITRA, AYA, NIA, all major other institutes, Bharati Vidyapeeth, and all other who have contributed into this research project, they are gathered here. All these experts are here. So I'm happy that they will be able to share their first-hand experience also, and observation also, what has happened and what was the priority, and how they have achieved this much of big repository and evidences of different candidates and researches in very short period of time. To be precise, in this more than 1 year period, there was 120 different designs of research studies were conducted, right from different types of clinical studies, randomized trials, to observational studies, to population-based studies, to all different designs, or on standard as an adjuvant or as a standalone therapy, or there are so lot of preclinical studies, lot of in vivo in vitro studies and docking studies. So this much of huge kind of work have never happened. But besides this, more important is the practitioner's perspective, contribution from the practitioners. It is huge. Over the period of time, I also came to know, and then I was constantly updated by my colleagues and by states and by practitioners, and that they are doing wonderful contribution for the help to the COVID patients all over the country and some parts of the world. So that particular perspective is very important. Our I should not only praise, but I should also mention, because I'm also part of this community. I'm not the outsider. We all. So I am using this we word in place of you word. So we all are having one problem, that we are not having that level of competency of recording and documenting of whatever we do in general. And that is a lacuna, because we do great work, a lot of good work, lot of good. You can see social media and WhatsApp are loaded with lot of such testimonials of patients that they have taken certain Ayurvedic or some Ayush medicine. They have taken some homeopathy medicine, or they did something and they got very good relief. These testimonials are also evidences. But if it is backed by proper documentation, it is like a kind of value addition, because the patient testimonial is perspective of a patient. So there is a possibility of bias, because patient not only do your medicine, but they do all the other things, and patient cannot recognize what has worked, but something has worked. So from a scientist perspective, if we have little bit of training to our practitioners, how to document this, how to take it forward as a case study, as a case documentation, case reporting, then it adds a lot of value to the scientific evidence generation task. Our sciences, traditional medicine sciences, are usually blamed that your researches are anecdotal, you don't know how to do research, because their spectacles are framed according to their training. It's nobody's fault. They have a certain training, so it's very specific, very structured. So if something is not fitting into their structure, it is termed as anecdotal, which is normal. So we should not be offended. But we have to upgrade ourselves. And as our Honorable Prime Minister in one of the occasions of Man Ki Baat mentioned, that we have to generate evidences in the manner, in the language, what they understand, because they are the millennial people. They are the majority of the ownership of science and decision makers largely. So we have to convince them with robust scientific evidences in the manner, in the language, what they understand. There's nothing wrong about that, and we should consider this as an upgradation of our own knowledge or our competence. So we should take it as a challenge in place of taking as a hurdle. So that is a different perspective. Our approach is as a challenge, then our all energies, all Pancha Gyanendriya start working, and works with mind, and mana achieves big thing. But if we take it as a hurdle, this hurdle creates negative kind of energy, and then our goal is is it stays somewhere behind, and we cannot achieve big things. So dear friends, dear colleagues, uh, at the end, what I wanted to convey is that we should be focused, we should be goal centric. We have a goal of achieving big evidences based on case reports, and these case reports should be publishable. So that is what we are talking today. All these experts will be talking about that. How to do that? That will be the prime objective of this webinar. But on the top, if we collectively work hard doing this, then imagine how much of big evidences and big data can be generated. So thinking big and achieving big needs attention and goal-centric approach like Arjun, and that is what is required for by all of us, including me, our community. Last thing I want to mention, I want to inform the August audience of today that Government of India, in association with Amrita School, in association with our own autonomous institutions, ITRA, NIA, All India Institute of Ayurveda, Savitribai Phule University, Bharati Vidyapith, some of the scientists guided by Professor Patwardhanji, who is the National Chair of AYUSH, National Professor of AYUSH. We have created a IT-based platform of repository. Tomorrow at 4 p.m. our Honorable Minister Kiran Rijiju is launching this repository platform. So as a follow-up of this case report series, it is immediately available. So this is like a very good coincidence that today we are discussing about how to document these case reports, and if somebody has a good documentation, they can actually submit all those documentation to this repository. Is meant for capturing such good practices, such success stories, and then it will be properly audited, properly screened and scrutinized, and then authentic scientific documentation will also get place on this repository eventually for the public domain. So it means that if somebody wanted to see which are the good practices of Ayurveda or other Ayush sciences, they can go to this web platform and then they can see that a doctor sitting in Aurangabad or sitting in Thiruvananthapuram or in some of the place of our country, they have treated X number of COVID patients and they did this therapeutic intervention and the patient got this much of relief. So that is a very important interface that Government of India has created that I want to inform. I have one more information before I close is that we all know that recently with the help of AYUSH CSR randomized control trials, which was driven by the team of scientists. Govt is also part of this team, and our National Institute's leadership, guided by Professor Patwardhanji. All these different scientists, Dr. Chopra ji is a really chief clinical advisor for this project, and CSR is also on board. So through this AYUSH CSR studies, recently we found that AYUSH 64, which was originally invented for the malaria, treatment of malaria. Later, in some studies, it was found that it is antiviral, it is antipyretic, it is anti-inflammatory, immunomodulator. So those functions we looked at, and then a group of scientists have decided to look at the possibility of repurposing this for the COVID treatment. So recently, the latest news is that the study is completed, and then this group of scientists have recommended to use AYUSH 64 for the asymptomatic, mild, and moderate patients of COVID. So it was accepted by Government of India. Anyway, it is a part of National Clinical Management Protocol by Ayurveda and Yoga. So now large-scale implementation of giving the AYUSH 64 to the patients of COVID-19, mainly under home isolation, because they are largely staying at home till the moderate level of disease. So this observation of these studies that it can be added as a standard of addition to standard of care and can be given to asymptomatic, mild and moderate cases, and the possible outcome is that they usually don't go to the severe state of the disease. So they don't need to go to hospital for the support of oxygen or support of ICU or advanced level of treatments or emergency treatments. So that is a big help, and I would use this opportunity to interact with all these practitioners across the country. Please spread this word. Please also use AYUSH 64 for the treatment of your patients, because it is clinically tested and evidence is quite strong. And and then it is available all over the country. In market also is available, and Government of India, with the help of National Institutes and Research Councils, is also distributing it for free across the country with the help of some NGOs like Seva Bharati and other NGOs. So please take this opportunity and then help us for this spreading of this word of AYUSH, and its good use for the COVID-19 management. Through this case report series, maybe we may find so many options. So that is also today's agenda. One thing that I want to clarify, there is a large misconception in some of these states, not all states, that Ayurveda practitioners or Ayush practitioners cannot treat COVID patients. It is not true. Legally, they can treat COVID patients. There are telemedicine guidelines also. You can support them with the telephonic consultation also. And there is no prohibition of treating COVID patient by an Ayush practitioner. This is one clarification. Another clarification is that there is a practitioner's guideline of different streams of Ayush. Is available on Ministry of AYUSH website. So these practitioner guidelines are largely to how to help to the patients at which stage. But believe me, you are all registered practitioners, very experienced practitioners. So if you see that a particular patient for some particular symptom, they need some more medicine, you are free to use that. So there is no prohibition. So it should not be, these guidelines should not be seen as a structured and nobody can go outside of this guideline. It's not true. It is a general guideline guiding the practitioners to take a certain approach. But because if you see a patient needs a particular medicine for a particular condition, a particular symptom, you can use that as long as it is from the classics and it is approved by the law of the land. There is no problem. So these are the few clarifications also. I thank all of you for inviting me and giving this opportunity. Namaskaram, pranams.
Thank you, sir. Thank you for your inspiring presence and a lot of information. We really feel proud and enlightened when we know about various such efforts. And Buddha Purnima is all about enlightenment. With these words, as Honorable Kotichaji said, when going gets tough, the tough get going. And this is the time where Ayurvedic practice is changing its paradigm from degenerative diseases, management of lifestyle diseases. We have shifted our management to acute infectious disease, and many of our institutions, they are really doing great job and initiating a lot of activities. And hence we have invited the leadership of our national institution to say a few words about this entire activity. I request Director of All India Institute of Ayurveda, Professor Nesri ma'am, to say a few words. Over to you, ma'am.
Namaskar. Honorable Secretary, Ministry of AYUSH, Padma Shri Vaidya Rajesh Kotichaji, Bhushan Patwardhan ji, my colleagues from National Institute, Dr. Girish Tillu, and all the faculty from the Savitribai Phule Interdisciplinary School, and those who have been involved in this exercise of care, case report exercise, conducting the workshop from the Amruta School, Dr. Ram Manohar, and all the esteemed members and the panelists and the audience. My pranam from All India Institute of Ayurveda. And my all good wishes we extend our best wishes and congratulations for this very, very timely conducted workshop, because the care is the one which is the style in how we write the case reports, which are, it is very well said, absence of evidence is not an evidence of absence, but if we really report a very good outcome and a well documented cases, I think that becomes also the evidence for the entire world to understand and to believe that Ayurveda really works. So not discussing other things, but I would like to directly share the experience of All India Institute of Ayurveda for last 1 year. Under the Ministry of AYUSH and the able dynamic leadership of Ministry of AYUSH and Government of Delhi, NCT, and Health Ministry, we could able to start COVID Health Center. The tagline itself is a unique, is a care with compassion, where I'm really happy to been to say successfully because we really have 99.99% success in treating with holistic Ayurveda and integrated approach. So that's I really mean because when we say that it is a COVID-19 cannot be treated only with Ayurveda, but it is the certain guidelines we have to follow is CCC, that is a COVID Care Center, and it is COVID Health Center where mild in CCC it is a mild cases can be treated. In CHC we are really fortunate to have been given opportunity to treat moderate cases also because CHC is a COVID Health Center which is for mild to moderate cases. And then it is a dedicated COVID hospital where on severe cases, tertiary care hospitals are patients are being treated. So during last 1 year, what different things we could really do it that with the holistic Ayurveda approach, uh, some uh, some success stories on treating moderate cases also could be database could be generated, and it is usually the notion across the globe that Ayurveda strength of Ayurveda is in the prevention and prophylaxis. So why you are not doing only home care, isolation, and awareness and immunomodulation, but the Swasthasya Swasthya Rakshan is the strength of Ayurveda that can be really that can be fully utilized in this COVID for strengthening, for prevention, and for immunomodulation. Really, this is the COVID time where we could demonstrate our strength that Ayush is equally effective in public health and community health because of various research projects. What Secretary also mentioned that the data captured by Sanjeevani, one app by Ministry of AYUSH and CCRs, it says that more than 87% respondents say that AYUSH preventive kits are being used by public, one or the other, and the responders say that. And our own study on 80,000 Delhi police, which is the largest public health research, says that the trend line during the intervention period of Delhi police was considerably reduced and also lowered down as compared to other metro cities and as compared to the same cohort of Delhi police. And also the mortality rate, fatality rate was as compared little low. And the result is what? Result is that we have again initiated the same intervention in this pandemic with the same confidence Delhi police has that they have really protected for getting infected. That incidence rate, positivity rate has come down. This success story we are definitely writing, but this care is not for that. Care is not for the large cohort study. But we want to intend to say that in COVID Health Center, where 500-600 cases database is there, I would just narrate the statistics because of the want of the because of the time constraint. I would say that amongst 600 cases, 94% patients are being treated with holistic Ayurveda treatment, and 7% patients had integrated approach. We could treat them with allopathy, combined allopathy and Ayurveda, because we have the CHC has a condition that there should be co-location of the conventional medical doctor, as well as the infrastructure should have, each and every bed should have the oxygen bed, because patient goes into hypoxia, he needs oxygen therapy, and supported with all diagnostic tests like RT-PCR, CT, MRI, and all investigations. What I would like to say here, even though in 94% holistic Ayurveda treatment guidelines, and yes, what Secretary Sir mentioned that we have practically implemented practitioners guideline There is no separate algorithm. We have used practitioners' guideline at all COVID health center, but our basic morning to evening, one protocol and algorithm has been created, and depending on the patient's condition, certain herbal and herbomineral um, medicines are being used. In the first wave, uh, we had more number of cases which really required intervention of Rasaushadis. More patients, majority of the patients were treated by the herbal kadha, Nagaradi Kashai, Kuchadi Kashai, Sanchamanipati, Sudarshan Ghanavati, and many other formulations, along with COVID appropriate behavior. And we have tagged it as a Ayurveda appropriate behavior because every patient has um, turmeric gargling with turmeric, Kabalagraha, nasal pulling, yogasan, pranayam, then recreational, and all these holistic and good diet, good counseling, mental, physical, spiritual, everything is one bouquet has been given. But in the second wave, where first wave we could really do the retrospective analysis as it is Jwara, Kaphavataja Jwara, Sannipata Jwara, Kaphavataja, and Shwaskas. But this wave, which is a mutant virus, each and every patient required, since from beginning itself required Rasaushad. That I really want to say this is the difference. And it is not as a Langhanam Pachanam Svedo Yavagu Tiktakoro. No Langana Pachana. Patient really required Rasaushadin. They responded, and that we have labeled this mutant variant as Agantujajwar. And in Agantujajwar, जो doshas are involved and the later stage. So we have created algorithm for treating Agantujajwar. And hence Rasaushadis, Shasaka Sachitramani, Suvarnamalaki Vasanta, Tripuvan Kirti, Mahalakshmi Vilas, Shruka Shungarabra, all these had to added even the holistic Ayurvedic treatment. Some tips I would like to give here. Some Rasaushadis, even though we have seen ADR, pharmacovigilance, we have a National Pharmacovigilance Center. So we have to be very cautious. And that's why the monitoring of when we write the cases, the diagnostic assessment, intervention, timelines, follow-up, all these needs to be meticulously and in sequence we have to write. So, for example, after giving Tribhuvan Kirti, we have seen the hypotension, but we could see because of the oximeter, oxygen saturation drops down. So, but at the same time, by adding Samir Pannak, Shungarabhra, and others, we could see the oxygen saturation goes up. So all these stories we have, case studies, each and every intervention, Sanjeevani really gives very good result in Annavaha Srotas and Jwara, but also there is a SpO2 goes down. We know that when D-dimer increase, when CRP increase, what is to be added? Most frequently used formulation at CHC is AYUSH 64, followed by Sanshamanivati and Sudarshan Ganavati. But there are many success stories. We have the success story of a patient whose SpO2 gone down to 76 and no one, even tertiary care hospital, could accommodate them. But slowly we could treat holistically with all our Rasaushadhi is a emergency management that we really have to see that what we could do. We could get an opportunity to treat with emergency Ayurveda management. So all this with all those words, what I would like to tell to all the youngsters who have joined that there is a strength in Ayurveda as Aturasya Vyadhi Parimokshaha. And this is the time when can we can use our inter-emergency management, but we have to have integration. We have to know our limitation. We have to know when to refer. And we really have protocol for the integration and for the standalone. So with this, I'm really happy that our 5 cases have been published, one in ZAIM and many others, and there are many in pipeline, and all those success stories could be registered in the ministry's case registry, and we are also partner with our all this strength of PG scholars, medical scholars. And I wish all the best. Thank you for giving this opportunity.
Thank you, ma'am. Thank you for these words and the information. And as you said, there are a lot many opportunities. And I would request Vaidya Geeta Krishnanji, who is in World Health Organization's traditional complementary and integrative medicine unit, and he is looking at the disease from an entire different level altogether, to say a few words. Over to you, Geetaji.
Thank you, Dr. Girishi. In fact, my pranams to Vaidya Rajesh Kotecha, Secretary, Ministry of AYUSH, Govt of India, and all the respected dignitaries and my friends and colleagues who are in this meeting, who are eagerly waiting for the program to start. I would just like to remind you, today is a very important day, or probably one of the very important days in the past 200 days or so, or 365 days or so in the COVID pandemic, wherein which Lancet published an opinion paper, which was co-authored by Dr. Bhushan Patwardhan, and it was like a Lancet Citizen Commission on reimagining India's healthcare system, and it was very specifically mentioned about AYUSH being utilized appropriately in the COVID management program for the best ways in which the country could come out of or evolve out of this COVID pandemic. So I think that's a very important milestone for us. In fact, I brought that over here because that's a publication. A publication is something which is very important. As we all know, the pen is mightier than the sword. So similarly, at this particular juncture, we would like to say that a prescription, or rather a case report, is much mightier than the prescription that it has evolved from. Like it's a way in which if you make it into a case report and make sure that it is available for people notice that, and then there are more and more people working on it, we generate a lot of evidence out of it, and then will come the final success of the science. It's a long journey that we have to move, as Vaidya Rajesh Kotecha ji said rightly. There is nothing wrong in people asking to understand our science in the way in which the only way in which they understand science. So it is their problem, but we sometimes have to be somewhat humble and supportive for them to understand what we mean as science and our science is. So everything starts with appropriate case reporting, and COVID-19 had seen such a large number of cases being managed by Ayurvedic doctors in different areas of COVID-19, from prevention to management to complications to hypoxia to post-COVID management, long COVID, etc. So I think all those has to come out, and it is I'm very happy to know that this repository from the ministry is also being launched tomorrow. So it's an apt time. I wish all of you a good time during this workshop, and I hope that you all successfully create many case records which will become gems of knowledge for Ayurveda. Thank you so much for giving this opportunity.
Thank you, Geetaji. Thank you very much for this perspective. Professor Anup Thakurji, who is the Director of Institute of Teaching and Research in Ayurveda, I request Professor Anupji to give his brief comments.
Thank you, Girishji, for inviting me and giving me this opportunity. Honorable Secretary Vaidya Rajesh Kotecha, Tanuja Nesri Madam, and Dr. Sanjeev Sharma ji, all the Dr. Geeta Krishnan, Dr. Ram Manohar, and it's a long distinguished speakers panel who are friends to me and a very renowned figure in the Ayurveda, who are involved in the research since long, and a great number of the participants. I'm able to see it's 520 now. So it's a really wonderful arrangement by CCIH, Savitribai Phule, Pune University. It's a really timely arranged program. When Ministry of AYUSH is going to inaugurate tomorrow the repository, case repository, and I feel that actually the national institutes and some renowned institutes are definitely doing research and reporting the cases and all these things. But I can see that if this kind of the programs can move the mass who is doing practice who are the real fighter of the Ayurveda, who are doing real practice in the field, and if they come forward and if they start to report in the scientific manner, that will change the scenario. And on that day, I can imagine if it happened, the people will stop to say that Ayurveda is not scientific or Vaidyas are not doing the scientific things. I think this thing can change the table, can change the scenario. And that's why this is a really a good movement to be supported and to take it further. If we have at least good case studies base, even on the basis of that, we can go for a further, research, intense research. We can have a good database. So many things, many positive things are there. I'm not going in detail because many experts will say about that. I just will in brief, tell about the activities ITRA is doing in the COVID. Dr. Tanuja Nesri has elaborated, but I will tell in the brief. Since last May when the COVID started, ITRA is a COVID care center, and actually mild and moderate patient, as Dr. Tanuja said, we are also handling since the beginning. We are giving the Pathya, the different line of treatment according to area and according to belief of the physicians, team of the physician. So Pathyadi and Sanjeevani, and then we have developed a Jwarhar Vati, that is our own, because when Kotecha sir was here as a vice chancellor, there was a swine flu was here, and during that swine flu we developed that medicine, and then it is really effective in the COVID also. So we are giving more than 400 patients in the small place like Jamnagar. We have treated COVID patient successfully, and we are also providing the medicine to GG Hospital, Guru Govind Singh Modern Hospital, which is the biggest hospital, modern hospital of Saurashtra region. And there also to the mild and moderate patient, we are providing AYUSH 64 and then this Jwarharvati and Shanshamnivati as a add-on treatment on their demand actually. And we are maintaining the records of all that things, and it's a really high in demand and providing very good results. Then we are successfully running the Dhanvantari Rath. Actually, it's a unique experiment we started in Jamnagar, in different area where the containment zone, where the COVID is more intense. There our Rath, means it's in ambulance. We go there and we provide the advice and treatment to the patient at their home. And that has get very much popular. Since 1 year we are running this Dhanvantari Rath, and more than 50,000 patient has been benefited with this Dhanvantari Rath. Moreover, we have involved in the many research studies, as Kotecha sir also mentioned about it. Actually, 3 paper has been already preprint, and 1 study is under process for the publication. And we are also doing systemic review, whatever the studies has been taken place during the COVID. We are doing systemic review, and first phase almost going to be completed. So lot many work is going on at ITRA during the COVID, and many new things has come. And actually the confidence is very high among the Jamnagar and around the area all over in the Gujarat with the Vaidyas, because they could see what is the success we are getting. Till date we were believing that in infectious disease Ayurveda is not effective, it is only for NCDs and all that things. That myth has been broken by this COVID pandemic. And the reality is, in the Jamnagar, certain rasaushadhis like Hemagarbha Potali or Jaimangal Ras, which is very useful in the fever, are in shortage, and some of the Ayurvedic medicines are also in shortage. That much demand is there. That shows how the Ayurveda has got footage in this COVID and acceptance in the public in this COVID. So without taking much time, because I know it's already 1 hour with this inaugural thing, I would conclude my talk. Thank you, Girishji, again for me giving this opportunity. Thank you.
Thank you very much, Anupji, for this information. Now, today we have presence of our guru, mentor, Dr. Ashok Vaidya sir. And Vaidya sir, he is guiding us right from the beginning. I request Vaidya sir to share his vision and blessings. Over to you, sir.
I congratulate AYUSH as well as JIM and all of you for taking up seriously not only the research in COVID, but relief in COVID. And that's why what distinguishes Ayurveda is that we don't wait for everything to be proven. We have thousands of years of history. We have treated influenza in 1918. I was part of a 1957 survey in Bombay when a severe flu also attacked. And I feel that Tanuja has nicely summarized that what a wonderful database we have, as well as Jamnagar has such a wonderful database. What I request Rajesh Kotecha ji is that we need to truly write this up, analyze, interpret and write this up in such a persuasive manner that all the prejudices which exist against Ayurveda and individualization of therapy in Ayurveda vanish. Next, I would like to say that in the last survey in 1957, we had gone to thousands of homes to find out. And we found out that time that the Bhuvan Ras had a wonderful effect in large number of patients. And Tanuja rightly mentioned that in the second wave, she is using Rasaushadhi. And Rasaushadhis, when used properly, I would say even in terminal cases or cases which are very bad, Hemgarbha Potli Ras and Hiranyagarbha Matra should also be studied. But I congratulate Tanuja for taking this effort. I think it's not easy to do this work when all are suspecting us that what these quacks are doing. And I think that this particular today's webinar, I congratulate Girish and all the speakers and Geeta Krishnan sitting in Geneva in a way. I think he's our best ambassador. And he must carry this message in a cogent manner to convince not only WHO, but to convince NIH, to convince National Institute of Communicable Diseases, Dr. Fauci, and really get major support to study at least 3 plants and formulations. I have first paper in March in last year I published myself, Dr. Dilip Mehta, as well as Ramavidya. And I think in that we have mentioned that very important is andrographolites. So andrographis is a very important antiviral agent of flu viruses. Second very important to me is obviously Tinospora, and a lot of work is done. AYUSH 64, I personally felt is an effective drug, but the matras are not sufficient in terms of its concentrations. And very important is Sanjeevani, which Tanuja brought up, also Anup brought up. I think that hardly ever I have not been able to treat a pyrexia of unknown origin with a good doses of Samshamani Vati, stiff doses, along with Sudarshan Ganpati. Thank you, Girish, for giving me this opportunity.
Thank you very much, sir. And I'm also going to share your suggestions and guidance with the participants later. Thank you very much for joining. I know you have very busy schedule today. Thank you very much for your blessings. And I'll request Director of National Institute of Ayurveda, Professor Sanjeev Ji, for his comments.
Thank you, Rishi, and very good evening to all. Am I audible? Thank you. Respected Vaidya Rajesh Kotecha Ji, Honorable Secretary AYUSH, Government of India. My regards to Professor Bhushan Patwardhan Ji and Vaidya Ji. My all fellow colleagues, leaders of the National Institutes, all esteemed panelists of today's this webinar, and all the friends and participants who are there on this platform and listening these useful deliberations. First of all, my heartiest congratulations and greetings for the organization of such a wonderful event, and at a very required time, because we are living under the cloud of a pandemic of the COVID-19, and it is very, very important that the knowledge base from our practitioners that should come forward in the form of case reports. Friends, we know that this modern world is dynamic, it is emerging, demanding and changing, and even a micro addition of the new knowledge or micro revelation of the forgotten or ignored knowledge, that is very important to bring that forward, and that will be a big contribution towards the science and towards the humanity. And that is the, I think that is the basic idea and gist of this webinar. I know that and we all know that the medical case reports, they can come with the new ideas, new research, new experience, and they're very much helpful in the clinical practice also, to forward the clinical practice. And they can also present a rare presentation of the disease, and in the case of COVID, and the rare presentation are different presentations of the COVID, because we know that the COVID-19 is being presented in different ways, and this is also perhaps the gateway of medical writing. And the students, right from the beginning, even at the graduation level, the students, they must be involved in the case writing, and they should be trained. I personally feel that our training somewhere was faulty at that time, because we were not trained at the time of when we were at graduation level, and we could not, but later on we realized, and now we feel, and as a leader of our national institute, as a national institute, I strongly recommend, and I am putting this in my institute also, that the graduates, they should be trained for the case reporting, and that will be the starting of their career in the scientific writing. We know the limitations, and there are certain notions that which demotivate our writers for paper this medical case reports writing, because of the poor citation, or some journals, they may not prefer to get the case reports, but still we have to motivate our practitioners, our scientists, our scholars, and our students to write the medical case reports. That is very important, and today's this webinar, definitely that is going to help. So far as our initiatives at National Institute of Ayurveda in Jaipur, apart from all the national programs which have been initiated by the ministry, we are the part of all those studies, all those programs. And recently, I'm happy to share that the NIA in Jaipur has been permitted the COVID Care Center purely on Ayurvedic lines. That is the great breakthrough, and our state government has permitted us that thing. And up to the moderate patients, we can treat our patients in our wards with pure Ayurveda protocol. And we, from since beginning, we have also included the Ras Aushadhi. Wherever there will be a requirement, we shall also give Ras Aushadhi under the supervision of our experts, and definitely that is also going to make a big breakthrough. And if whatsoever will be the outcomes, we shall be coming with the case reports, or case series, or case studies, or some other kind of public scientific work. And another initiative which the ministry has initiated, that is the AYUSH 64 and distribution among the COVID positive patient, and the NIA has taken a big lead in that, and more than 2 lakh tablets we have distributed right till now throughout the Jaipur Jaipur and other adjoining districts of Rajasthan. So in this way, NIA is also contributing a lot, and definitely there will be good outcomes. And I hope that this webinar will be very useful for our practitioners, for our students and scientists, that they will get motivated to publish their work in a proper way, that how to present their cases or their work, and how we can go. And this is nice time also that tomorrow the IT-based platform of the Ministry of AYUSH is going to be inaugurated, and this will be best opportunity to deposit our work there in that IT-based platform, and we can get published there also and in other journals also. My best wishes and my thanks again to the organizers for giving me this opportunity, and my best wishes, heartiest best wishes for the successful conduction of this program. Thank you very much, Girishji, and thank you all here. Thanks a lot.
Thank you very much, sir. We are now eager to listen to Dr. Sanjeev ji, Sanjeev Rastogi ji, and his topic, the value of the case report. Sanjeev ji has experienced this pandemic as a Vaidya, as a caregiver, even as a patient and as an editor. Over to you, Sanjeev ji.
Thank you, Girish, for giving me this opportunity. It was really an honor to participate in this workshop, and it was an honor to listen to the voice of the luminaries who had been doing wonderfully in the field of Ayurveda. So without wasting any further time, I'm going to begin the assignment which has been given to me, that is the value of the case reports. So we are going to talk about the value of the case report. Conventional value of the case report, we know that conventionally case reports have not been valued too much in the medical literature. This is on the account of, as Dr. Ram Manohar was saying, that it is only because of it contains very small sample size, it is not having any comparative control, and it is not involving any measures for bias minimization. And for that reason, if you look at the evidence hierarchy, the case reports and the case series are being kept at a very, very lower level. And for this is the reason that why many medical journals do not really prefer publishing the case reports. Looking at the perceived value of the case report, we see that the perception has got little changed these days. Case reports have got a greater relevance to the medical practice, in fact, because it is originating from a practitioner and not from a researcher. It is based on the observation from the real clinical settings and not on the controlled setting. That's a wonderful thing, that it is what is being shown in the case report is from the real clinical setting. And moreover, it is based on the patients on as they are conditioned. I mean, we are not filtering the patients for any inclusion or exclusion criteria. So the case report presents the real value which is adhered with the patients. And it follows a practical approach as per the clinical needs, therefore has better generalizability. Many times with this kind of generalizability is not available with the randomized controlled trials because of the very, very strict inclusion and exclusion criteria. So sometimes it happens that the case reports may be having a better generalizability because it is coming from the real clinical field. And moreover, it is having a retrospective analysis, allowing a cause and effect assumption for planning of the future researches. So for this perceived value of the case reports, now the value has been changed, and many high impact journals have started considering case reports, and many are exclusively devoted to the case reports. Even the British Medical Journal has started its own case report journal. And in Ayurveda also, we know that we have started a journal solely dedicated for the case reports. So let us look at what are the case reports. So case report is primarily being defined by three key features. It is very, very important to understand that what are the case report and what are the things which are going to be reported there in a case report. So primarily case report is a scientific documentation about the observation made upon a single patient. That's fine. It should have a component of novelty, that is documenting something which is either uncommon or is unknown and is worthy of reporting. This is very important, that what we are going to report is worthy of reporting. And this is also very important to understand that case report is not limited to the outcome reporting. I mean, it is not limited that there are some kind of adversities or there are some kind of positive outcomes in a patient, but it can report any observation beginning from the cause of the disease to the complication during the course of a disease. So everything whatsoever is being observed in a patient, this could be reported as a case report. So these are the features which are associated with the case report. There are certain case reports which have made the history. One very important case report which was published in Lancet in 1896. This was related to the first use of X-ray to visualize a bullet in situ. This was possibly the first medical use of X-rays in making a diagnosis. And see that how early it was published. It was published in 1996 in Lancet itself. Second very important case report which was published in 1967 was related to a first human cardiac transplant. This was the first reported human cardiac transplant, which was done by no other than by the Honorable Christian Barnard, Dr. Christian Barnard, who is the pioneer in the heart transplant surgery. So this is also, I mean, see that these are the case reports which have really have made the history. This case of phocomelia, everybody knows about that. This is a thalidomide disaster, and this also came into the notice of the medical fraternity or medical field only by means of the publication of the case reports. 3 cases of the phocomelia caused by the teratogenic effect of the thalidomide were first reported in 1962, and subsequently many more such cases were reported, and eventually and ultimately this drug which was being used during the pregnancy was completely withdrawn. So this was the impact of the case report. We also we have started seeing the case reporting in COVID-19. This is the case, these are the cases which have been reported there in the European Union. First cases of coronavirus disease in the WHO European region. This was published, and here in India also a lot of case reports like this have been published. First confirmed case of COVID-19 infection in India. This was also reported in IGMR. So let us talk about the importance of the case report. There are certain very specific goodness which is associated with the case report, which is not available in any other kind of research method or research format. The primary thing is that it provides the first-hand information about some unique observations seen in a real clinical setting. That's very important. Comparing to the clinical trials with more defined inclusion and exclusion criteria, case report gives access to all meaningful observations in a complex clinical setting. And it gives an opportunity to the clinician to share their rich clinical experience and to contribute to the growth of the science. It requires very less planning. Case report do not require a very big planning. It do not require a lot of funds and do not require much of the time to plan and to do it. And it can be done retrospectively, which is not possible in most other research methods. So this is the only method where you can have a sort of retrospective analysis. Now, if we look at the case reports in Ayurveda, there are certain peculiar things which are associated with the case reports in Ayurveda. So there are 3 things which need to be understood while understanding case reports in Ayurveda. One thing is this, that case reports can be kept on the backdrop of the hiccups of the clinical researches in Ayurveda. We know that doing a serious RCT is a very tough job in Ayurveda. So many times it happens, it is because the complex therapy which we are using a comprehensive package of the treatment, we utilize whole system approach. We use Pathya, lifestyle, Samshodhana and Samshamna together in the clinical practice. And we all understand that blinding and placebo designing for the complex procedure and complex drug preparation is nearly impossible. So for these reasons, doing a serious RCT is a very tough job in Ayurveda. So what we have understood, I'm pretty convinced that a repeat case reporting on effectiveness on some interventions may initiate a serious RCT subsequently. I mean, it can put value. It can put value that this is an important area and some serious research should be taken up in this area. The second important thing is, which we need to look at while talking about the case report in Ayurveda is on the backdrop of the uniqueness of the Ayurvedic clinical practice. We know that in Ayurveda, we prefer doing the personalized therapy, and personalized therapy is not only personalization of on the basis of the patient, but this is also personalized as per the choice of the physician. Many times it happens that it is the discretion of the physician to choose the intervention as per his own understanding of the disease in a particular individual context. One physician approach may be different than others. So what is needed is to identify which approach is better, and it is required to be filtered and reported so as to be followed by others in the field. So case report can play a very important role in this area. And finally, a very important thing which we need to understand is that Indian clinical practice is very, very unique, and Indian patient behavior is also very, very unique. Let us look at that uniqueness of the Indian clinical practice. We find that patients are often at the crossroads, and they do not really do not have the proper ideas to choose or to decide which way to go. So for this reason, what we see in Indian clinical practice, that polypharmacy is almost a rule. Everywhere you will be finding that for the same disease, they might be taking multiple kind of therapies, multiple kind of treatments. Switching to the healthcare system is very, very common. Sometimes they take some specific kind of treatment, and if they are not satisfied immediately, they might be switching to some other system of medicine. So this is also a very common phenomenon. Folklore and home remedies are very common in India. Denying the standard recommendation and choosing the options as per one's comfort, this is also very common patient behavior. I mean, they might have been referred by the treating physician to go for some standard kind of therapy, but if it is not coming within their purview or within their comfort, they might not be obeying the command or decision of the doctor. So they might be denying the standard recommendation. So this is also a problem with the clinical practice in India. And last moment consultation or other AYUSH system, this is also a very, very common thing. Everybody who is practicing during this COVID-19 might be having the similar kind of feeling that Ayurvedic people or Ayurvedic doctors are usually contacted when the modern medicine has given up. So this is also, and Ayurvedic doctors are very perplexed in that situation because they feel that the things are already worsened or it is already gone. So this is the uniqueness of the Indian clinical practice. So case report is the only research format which can accommodate all this, provided that what all is there in the clinical practice should be mentioned honestly in the case report. If it is a polypharmacy, that should be honestly mentioned. If it is if the patient have already taken some folklore or home remedies, this should also be mentioned. And if it is a last moment consultation, this should also be mentioned. So if it is clearly mentioned in the case report, possibly this is going to be a very, very important research format which can accommodate these all problems, which otherwise are going to be associated with any other kind of research method or research format. These are some of the examples, some of the case reports which I already have published, and this incorporate all these factors which I already have discussed. So this is one case report which I published. This is about low pressure, low flow, voiding dysfunction in an elderly male treated through Ayurveda case report. And this contains all these features which I talked about. I mean, this was the patient which was already being treated by a urologist. And when the urologist was not able to treat him, they were just wandering here and there to find some kind of remedy. They came to me, and I have started treating just by explaining them that I do not have an expertise in that area. But see, I mean, you can check that if Ayurveda can be of some help. And fortunately, this was of great help. So, but what we did while putting this as a case report, we mentioned each and everything very, very clearly, say that this was the initial condition of the patient, this was the initial treatment which was being received by the patient, and this is where we intervene, and this is what we have obtained. So that way the case report can give an enormous value to the system of Ayurveda. Similarly, another case which is treated by Ayurveda, again, it was earlier treated by the modern, in a modern setup, in a modern ICU setup. This was a coma with the Glasgow coma scale score 3. I mean, it was having a very bad prognosis, in fact. And the neurosurgeons have given up. And again, in that situation, they were looking at some Ayurvedic remedy or some alternative remedy somewhere. So they came to me. And then again, while just with explanation of the prognosis, we have started some kind of Ayurvedic therapy. Unfortunately, we have got some good responses. So again, I preferred reporting it. So this is also reported. Similarly, in COVID-19 also, I published a case report, which was published at no other place than JAIM. And this was a co-intervention. I very specifically mentioned this was a patient which was already admitted there in ICU. It was a case report from Delhi itself. In a tertiary healthcare center, this patient was admitted and he was receiving all kinds of standard therapy, which was being recommended by the modern physicians. But because of the patient was not responding well to the kind of treatment which was recommended to him, the attendants were trying to find out some other kind of alternative remedy. Fortunately, we have given some kind of remedy, some therapy to him, and he recovered completely. He recovered completely. So we again, by mentioning, by keeping these all things into the point, into the consideration, we have mentioned and we have clearly specified that this is how, we suppose that Ayurveda co-intervention might have supported in the complete recovery of the severe COVID. So this also presents the Ayurveda very nicely in this kind of situation. Case report is the only format where a physician can report about himself, and this is the case report where when I suffered with the COVID-19, my personal observation, how I took Ayurveda, how I felt, and how I felt that how Ayurveda is really supporting me to recover. This was the first account where a physician himself has given the account of him as a patient. And if you look at the medical literature, possibly you would not be finding these kind of authentic documents at so many places. In Ayurveda, I'm not able to find any document where the physician reported on himself. So this is the beauty of the case report, that you can report your own observation upon yourself also. This could also be a form of the case report. So let us summarize the summary points. The case reports are the unique tools providing opportunity to learn from the experiences of the others. In Ayurveda, this is more important on account of its personalized clinical approach. Individual method of making the diagnosis and choosing the treatment may help others to improve their skills on the behest of others. And case report may work as a proof of concept to initiate serious research. This is all, this is the value which I would be adhering to the case reports. Thank you. Thank you very much.
Thank you very much, Sanjeev ji. And from the organizers' behalf, I wish to say that this webinar is just a beginning, and we are going to get opportunities to have interaction guidance from experts like Sanjeev Rastogi ji and many others who are present here. My colleague Dr. Galib ji is going to share a questionnaire with questionnaire means a short Google form in chat box, so that if you are interested to participate in further interactions, workshop, hands-on activities for writing case reports, you are welcome. Because we have to share our learning. That is the idea. So I request Galib ji to share the Google form for further activities. Thank you, Sanjeev ji. Friends, in this WhatsApp era, many times, so thank you, Sanjeev ji, and you will be continuously interacting with interested participants and share your experience.
Thank you. Thank you. Thank you, Girish.
Thank you, sir.